Yeah. So my name is Vera Dubovoy. I am a board certified OBGYN as well as lifestyle medicine physician. I moved here to Virginia last year from Texas, where I worked as faculty for the University of Texas. I was clinical assistant professor in OBGYN for several years. And then when I moved out here, I decided, well, I think it's time to start my own thing. Because I truly believe in the healing powers of lifestyle medicine. And I feel like as physicians in our traditionally employed practices, we're not able to address a lot of the problems that patients really, need to get addressed to get to the root cause of their problems. So my practice is called Dubovoy Integrative Health. And of course, since I'm not affiliated with any type of corporate medicine or anything, I don't have any disclosures or anything for my talk today. Our objectives today are going to be fourfold. The first, we're going to talk a little bit about why are hormones important and what exactly are the hormones that we're talking about for our discussion. And then how stress plays a role in our hormones and our hormonal health. And then the fun part is talking about natural foods. That's why we're here at Elwood Thompson's, because health starts with what we put into our body. We are what we eat. And so we'll talk about some foods that can help balance our hormonal health. And then lastly, this is always fun, is just doing a little bit of deep breathing and mind-body skills that can help with relaxation and actually with clearance of our toxins in our body. So first we'll do a little bit of endocrinology. What are hormones? So there are many, many different hormones, and traditionally we think of sex steroid hormones like estrogen, progesterone as our hormones, but of course there's many, many more. And so hormones typically we think of as our sex steroid hormones, estrogen, progesterone, but also now with obesity being an epidemic in the United States, we see a lot of leptin resistance and ghrelin being important. There's also our thyroid hormones, which are incredibly important. And our hormones regulate every single body system in our body. So as you can see, it affects every single organ gland. And we have something in medicine called the HPA axis, which is the hypothalamus, pituitary, adrenal axis. And we see oftentimes HPA axis dysregulation or dysfunction, which a lot of times has to do with stress in our society, which we'll talk about here in a little bit. But we have two different parts of our brain, the hypothalamus and the pituitary, which help regulate our hormones. And they secrete cortico-releasing hormone and adrenocorticotropic hormone, which in turn stimulates the adrenal glands to produce cortisol. And we'll see how cortisol affects our sex steroids, and cortisol a lot of times we'll see elevated in patients with chronic stress, which is so prevalent in our society. So I show this to all my patients because I think it's important to think about where are our hormones coming from. And our hormones come from cholesterol, and cholesterol recently has had a pretty bad rap in our nutritional society, which is crazy because if you consume a low-fat diet, you're actually preventing all of your downstream hormones from being produced in your body. So cholesterol is really important. Eggs are great. And cholesterol produces pregnenolone directly, which then goes and turns into progesterone. And then progesterone, of course, gets translated to other forms of sex steroid hormones like DHEA, our androgens like testosterone and DHT, and then also our estrogens. And then, of course, cortisol is also a downstream hormone that's produced from progesterone. There's lots of different symptoms of hormonal imbalance and a lot of different conditions that are related to hormonal imbalance. So as a gynecologist, I see a lot of hormonal imbalance with fibroids, endometriosis, PMS, also PCOS, and also, we think about a lot of times fatigue Anxiety, we talked a little bit about the hormones that regulate our weight. So leptin and ghrelin, so weight gain, difficulty losing weight. Sleep disturbances, a lot of times is directly related to cortisol and our stress hormones. And so it's kind of this cyclical pattern that we see. And then skin and hair changes, libido, a lot of times we think of libido in terms of testosterone. There's now an epidemic of erectile dysfunction in men, which a lot of times is hormonally related. Mood swings, so just a lot of different things that can be related to hormonal imbalance. So what is stress? It's really important to talk about. In Western medicine, we don't really talk about stress because we don't do anything for it. We don't have a pill for stress, right? So stress in your body can come from inflammatory foods or an inflammatory diet. It can come from trauma. It could be physical trauma, psychological trauma. When I was in Houston, I worked at TIER, and I directed the Women's with Disability Clinic there at TIER and worked with a lot of women who had spinal cord injury. And after spinal cord injury, our bodies take a direct emotional and physical trauma insult. And as a result, we don't have our periods oftentimes for 6 to 12 months. And our body is kind of closing off a little bit of that as a direct result of trauma. Shutting down our hormones as a direct result of trauma. Toxins, of course, and we'll talk a little bit about toxins that are in our environment, endocrine disruptors, things like that, that can absolutely stress our body and affect our hormones. Infections, smoking, and disruptions in sleep also cause stress. So I graduated from OB/GYN residency, which was quite stressful. And actually, when I went to medical school, I started a regular yoga practice because I needed that for balance in my life. After I finished my residency, I worked night shift on labor and delivery and dealt with a lot of emergencies at night. I was the only OB/GYN there as the OB hospitalist for a couple years. And that was quite stressful. So this is me post-call with one of my yogi friends who is a physician assistant who went to the Himalayas and did a lot of Iyengar prop yoga. And she put me up in this little headstand. So I think we all need balance, and our bodies are made for balance. We naturally want to regain that homeostasis and that balance in our life. So I really like this picture because it's me just post-call trying to recover. So we talked a little bit about a stressful diet. So what is a stressful diet? It's kind of the standard American diet that we hear about. It's a high glycemic load diet. It shifts our body into this sympathetic overactivity, which increases our cortisol, lowers our progesterone as a result, which we'll show you again here in the next slide. And then it affects our other hormones and decreases our heart rate variability, which is really important for coherence of our sympathetic and parasympathetic nervous systems. So inflammatory foods increase our cortisol, and as a result of increasing cortisol, it decreases our upstream hormone, the progesterone. So we see maybe a little bit of estrogen dominance due to just lower progesterone from elevated cortisol in our blood. Stress affects every part of our body. It affects our brain and nerves, can cause multiple problems there. It can cause problems with our skin, muscles and joints, heart, stomach, a lot of GI discomfort. The reason why a lot of times we think of sympathetic, which is our kind of like active fight and flight central nervous system, as being kind of shutting off our GI tract. So that's a lot of times associated with constipation. And then parasympathetic is our rest and digest, relaxation, deep breathing, which is associated with kind of healthy GI function. And then, of course, it affects our immune system, which I think we've seen a lot of now in the past couple years with COVID, the importance of stress in our immune system health. So now this is kind of the fun part, hormone balancing foods, food as medicine, but it's hard to talk about good foods without talking about what to avoid in our food and beverage. So avoiding toxins is really important because endocrine disruptors are all around us. And we see it a lot with plastics and BPA, but now if things are BPA free, there also could be BPS in it, which is also a toxin. So you want to try to avoid maybe plastics as much as possible, drinking with stainless steel or glass. And then you want to avoid certain xenoestrogens that we see in our food supply. So a lot of times we see this with conventional dairy. There's a lot of bovine growth hormone that you would see. All of these affect our hormones. So you want to try to avoid any type of xenoestrogens in your body. Pesticides and herbicides also are endocrine disruptors. And personal care products, of course, as women, a lot of times our beauty is important, and so there's a lot of personal care products though that do have plastics in them as well that you want to try to avoid, because a lot of times we ingest lipstick whenever we drink beverages, and so they definitely get into our body. And then antibiotics, there was recently a ban on triclosan, which is the antibacterial hand wash that we use in the hospitals, because it's been found to be an endocrine disruptor as well. So we just have to avoid a lot of our toxins that we see, because a lot of times they can affect our endocrine system. And we don't a lot of times think about straws, but straws are plastic, and so there's a movement about trying to ban straws. Also, they're not good for the environment, but sorry, no offense. And then another thing we think about, a lot of times as natural things being healthy for us. But lavender, these are some lavender plants, has also been shown recently to be an endocrine disruptor. So it's something, you don't want to ingest lavender oil, or some of the herbs that you can buy in the store are, sometimes they have a little lavender in them, like the herbs de Provence has lavender in it, and then lavender tea. You would try to avoid these things because they can also function as endocrine disruptors. So this is a little bit more of the anti-inflammatory diet. So generally we would consider a Mediterranean diet to be a little bit of a healthier diet, high fiber, whole natural foods with healthy microbiome, prebiotics and probiotics. And the Western diet, of course, is generally processed food, low fiber. It's kind of like your meat and potatoes type diet. And it creates a dysregulation in our microbiome and creates generally ill health. So these are some of my favorite hormone foods, and there's so many wonderful hormone foods, and generally they're colorful foods. So we'll start with organic cruciferous vegetables. So the Environmental Workers Group has kind of like the Dirty Dozen, Clean 15, which foods definitely to try to avoid if they are not organic, because they may have high amounts of pesticides. And definitely with cauliflower and other type of cruciferous vegetables like broccoli, you would probably try to get a little bit more of organic, since you're eating pretty much the plant itself. The nice thing about cauliflower and cruciferous vegetables is that they can help detox negative estrogens, so bad estrogens in our body. They have a component in them called indole 3-carbinol, which sometimes you'll see supplements for, and that can be converted into DIM, diindolylmethionine, which generally helps regulate our estrogen and decrease the amount of bad estrogens that our body can convert in our cells. Also, cruciferous vegetables are high in fiber, which is wonderful. because fiber acts as a binder and can help us detox things. There's a big push now to increase the amount of fiber in your diet, and a lot of these foods are high in fiber. Women should probably, have about 35 grams of fiber a day. And so how do you get a lot of your fiber? Generally from eating whole fruits and vegetables. Artichokes are also high in fiber. They're really important for liver detoxification. Our liver is very, very important for helping to detox a lot of the chemicals in our body. And so that's one fun thing about artichokes. We talked a little bit about cholesterol kind of being the original molecule that converts into a lot of our sex steroid hormones. And so, a lot of times eggs and artichokes makes a pretty good omelet, or spinach with eggs. So those are kind of fun things to pair together. And then beans, of course, we talked about fiber being really important. All legumes are really great in terms of working as high fiber binders for our toxic estrogens. And they're generally very, very healthy in terms of our overall health. And then if you're not a vegetarian, wild Alaskan salmon is really, really good. So I put that up there not only for kind of its omega-3s, which are anti-inflammatory, and typically the Western diet is very, very high in our omega-6s, but also because there's been studies now that show salmon has the ability to directly reduce cortisol levels in the body. And also protein can actually help. So wild Alaskan salmon and beans and other forms of protein can help with insulin or with leptin resistance. So for patients who are looking for weight loss, a lot of times they end up getting leptin resistance. And leptin is a hormone that stimulates our satiety. So if we're resistant to this hormone, then we don't ever feel full and we overeat. But proteins can help with leptin resistance. And then nuts and seeds are really great. So this is kind of the picture of peanut butter. And then I wanted to go a little bit more in nuts and seeds because I'm a gynecologist and we talk about our cycles all the time. So you may have heard of this and you may not have heard of seed cycling. So these are kind of the important nuts and seeds that definitely regulate our sex steroid hormones that are important. And of course, nuts and seeds also are high in protein, so they can also work as binders. And it's kind of cool to see a huge following of the seed cycling kind of in the younger generations now. But we know that on our first half of our cycle, in our follicular phase, our estrogen slowly climbs, and then that leads to the luteinizing hormone or LH surge, which triggers ovulation. And so typically for that follicular phase, we usually recommend like flax seeds and pumpkin seeds during that time, which can kind of help clear some of the, they can boost estrogen production for ovulation and can help clear some of the bad estrogens. And then the second half of the cycle after ovulation, in preparation for the start of our periods, is an elevation in progesterone. And so these are the seeds typically that we recommend in that luteal phase or the second half, which is the sunflower seeds and sesame seeds. So that's kind of a neat thing. So this is what I usually recommend for my patients who come to see me. Kind of a little bit of overall well-being. So clean and nutritious food, and we'll talk about maybe some specific foods that could help their specific conditions. Clean air and water, movement. So the recommendations now are 30 minutes of moderate activity at least 5 days a week, so 150 minutes a week, or if you do vigorous physical activity, 20 minutes 3 days a week, so 60 minutes a week. But movement's incredibly important. And normal sleep-wake cycles is really important. So when I work nights, I definitely found myself in an HPA axis dysfunction, and coming back to working the days was definitely a huge change in my health. Relaxation is really important, and finding that love and meaning in our life, I think, is the core of health. So this is my love and meaning. These are my 2 kids. So I moved here last year to Virginia, 36 weeks pregnant, and so I had my little one here in Virginia, so he's a Virginian. And this is my older daughter, she's 2, and she refers to her brother lovingly as her boy toy. So it's been a joy to see these 2 grow up, and this is my meaning and why I do what I do, because I hope that in the future, they will have a healthy life and they will have a healthy environment that they live in. And so I'm trying to practice what I preach as much as possible as a lifestyle medicine physician. So let's do a little bit of relaxation here. So I think mind-body medicine is so important and something we can't really do in a 15-minute office visit with patients. And as a yogi, I feel like, deep abdominal breathing can be very healing. So if everybody can just have your feet grounded on the ground, maybe sit a little forward in your chair, and we'll just take some deep breaths with our eyes closed and try to imagine breathing in, expanding the belly with good air, and breathing out any negative thoughts or any negative feelings. And breathing in, expanding that abdomen, and breathing out, relaxing the abdomen. So with your eyes closed, we'll go ahead and do an exercise called square breathing. We're going to inhale for 4, 3, 2, 1. Hold. 3, 2, 1. Exhale. 3, 2, 1. Hold. 3, 2, 1. And you can do that square breathing now at your own pace. Inhaling and expanding our abdomen. Exhaling and releasing. And slowly we can come back to where we are, being present in the moment. Besides this technique, the square breathing technique, there's also a 4-7-8 breath that we can practice, where we breathe in for 4, hold for 7, and exhale for 8. A lot of times in our society, we don't take the time to just stop and breathe. And my first yoga teacher when I was in medical school would always say there's too many unsigned sighs inside of us, which I think is so true. So taking those deep exhales and deep inhales are incredibly important in our daily lives. I truly believe that the power that made the body can heal the body, that our bodies are just incredible. And a lot of times we just get a little bit off balance and we just need a little help to get right back on that path. And these are some of my favorite resources for those of you who may be interested in learning a little bit more. I love Mark Hyman. He's a functional medicine guru. He's got lots of great information on his website, foodthebook.com. And he has lots of different books about obesity, diabetes, insulin resistance. Michael Pollan, of course, is a really great foodie and a great author, and he has lots of great books that you can explore. And then, you know, it's kind of cool to look at the Blue Zone solution, where they look at all these societies that have a lot of longevity and what do they do that helps them lead healthy lives. And a lot of times it's kind of this community connection that in our society, you know, a lot of times we lack, especially with COVID now that, you know, for the last couple of years, most of us have been kind of isolated. And then in terms of sleep, I didn't talk a lot about sleep, but sleep is so important. The National Sleep Foundation recommends at least 7 hours of uninterrupted sleep at night. And, you know, a lot of times that's hard to get, but it could be related to hormonal imbalance that could be causing the lack of sleep, and then it's just kind of this cyclical pattern that we see. But Matthew Walker has a really good book about why we sleep and the importance of sleep, and he's an advocate for napping, which, you know, maybe the Spaniards have it right with their siesta time and their naps in the middle of the day. And then there is a mindfulness-based stress reduction free online course. And you can just Google MBSR free course online. Mindfulness-based stress reduction is something that was kind of created through University of Massachusetts and John Kabat-Zinn. And it's a way to remain mindful and present in our daily life. It's an 8-week course where they kind of walk you through different aspects of our daily life, like eating and how to remain mindful while we're doing those activities. And so that's a cool resource. And then my website is vaintegrativehealth.com. I live in Williamsburg, but I do have a clinic here in Richmond as well at the Wellness Village. I try to practice what I preach. I talked about that a little bit. So I do screen-free Sundays, but I am on social media on Instagram and Facebook. And then I plan on doing a lot more events in the community, because I feel like as physicians, we should be leaders in the community for health and wellness. And a lot of times, because we're stuck in kind of a employed position where we're overworked, we don't have time for that. So I love the idea of doing walks with the doc, grocery shops with the doc, and maybe other talks here as well. So, and I'd love your feedback. If there's anything that you feel like you'd want to hear more about, I'd be happy to maybe do a talk about that in the future. So that is all right now. I do want to leave some time for questions if anybody has any questions.